Monday Health Minutes, sponsored by Valley Health.
I'm Melanie Schaefer. This is Valley Health Minutes. You know, we all want a beautiful smile and great teeth health. And today we're talking about that with Dr. Vince Powell. He's a dentist that works for Valley Health, about when might be the time that we think, oh, maybe we have an issue and it's time to go see the dentist about possibly a problem. What are some of the symptoms that people should be looking for that might indicate there's periodontal disease?
Right. Well, the obvious symptom that most people call about is they've got a bit of a toothache. That's the most often symptom that we see. Oftentimes, when you're talking about periodontal disease, we're talking about teeth being tender when they bite down, and when the gums, it's always about burning or very sensitive when you're eating or drinking, and those are good indicators that you need to come in and get something checked out.
What can that indicate about your overall health, too, that periodontal disease? It can have impacts on other areas of your life.
Right. Well, what people need to understand about periodontal disease is this is what it is. Even the most avid daily brushers, you're not getting 100% of that plaque off of your teeth. And oftentimes that soft plaque can turn into a much firmer substance called tartar, which is very tough to get off your teeth. That tartar has a couple effects. One, it can create decay or cavities. That can cause a little bit of that toothache we're talking about. Also, your gums, they really don't like the presence of that tartar. So what happens is it creates a little bit of a separation away from the tooth. And what happens is bacteria can get stuck down in that pocket that's created, and it can make your gums real puffy. Okay, and oftentimes when they're that way, your gums bleed a lot, and they're real sensitive, and patients have a tough time brushing or keeping up, and so it kind of snowballs. It's a snowball effect. So when that happens, it's an important time for you to come in and get that tartar cleaned off, because, like you said, there's a direct effect between periodontal disease and some of the things that everybody's going through. For instance, when you're pregnant women have there's a couple of things that make pregnancy difficult, but in regard to oral cavity, you have a situation where you have cravings. Okay, that's very common. So
yes, it is. I can attest to it, yeah.
You have cravings, and these cravings sometimes aren't what's best for your teeth, and so it's tough. Sometimes you can get a bit neglectful because you've got a lot going on, okay, and so maybe you'll neglect normal care. And then oftentimes you also have a hormonal situation going on where it makes your gums a bit more agitated, and that's just pregnancy. You talk about the situation, the situation between periodontal disease and something like diabetes. You know, patients with diabetes have a very difficult time controlling their blood sugar level, and that causes periodontal disease. But what we find also is periodontal disease can make it very difficult to control your blood sugar. So it's kind of a bidirectional situation there. And so there's a lot of these little systemic diseases that make it tough for you to keep things in check with your gums. And so, you know, regular checkups are paramount to preventing periodontal disease from advancing.
And have an impact in another area of your life that you really weren't expecting.
Right.
So we need to consider that. Let's talk a little about tobacco use and what impact that has on your oral health.
Tobacco use, you know, what I'll see with patients is, and oftentimes there's not really much hiding it. The reason for that is because it's pretty obvious when somebody uses tobacco or even smokeless tobacco. It doesn't take very long for those to show up inside your mouth, and patients are really reluctant to admit that before the appointment, but when I ask them directly, they'll say, yes, I smoke. And it's because in your oral cavity, you're going through constant changes when you're smoking. And what happens is that change can be progressive. And so I have these conversations with patients all the time. Is there something I can do? Are you interested in smoking cessation? And people don't know this, but a dentist can help you with your smoking cessation. There's things that we can do and programs that we can start with you and enable you to tailor off of those cigarettes if it's something you're motivated to do. Because
that's interesting.
Absolutely, and because that tobacco is the #1 risk factor for oral cancer, and which is something that nobody wants to go through. But if we can either detect that early or prevent it from happening, is something that's going to pay dividends for you.
Not just about your teeth, but your overall health, for sure. That's really interesting. Now you mentioned, sore tooth, maybe bleeding gums. Would bad breath also be an indication that you've got something going on?
Yeah, absolutely. And what happens is often the reason why most people put off a dental appointment is because A, they don't have the time, B, they don't have the money, that they think it's going to cost them a lot of money. Well, unfortunately, by putting off your dental appointment, sometimes a very small problem or preventable problem becomes something that's a bit more expensive. that requires a bit more time to fix. It may require more time to fix and to heal from than you would have had to have originally invested in that. So oftentimes it's best if you just make that appointment and be preventative.
And how can you make an appointment?
Well, we have, you can go on our website, valleyhealth.org. You can find any of our locations. It has contact information for any of our locations. And also, you know, what I like to say is you can just Google our number. You know, I'm at Valley Health Westmoreland. And especially if you have a child that you'd like to get in, the way we work with Westmoreland is if you have a child that needs to get in, we can get them in within the week to get things checked out. And if you're an adult and in some pain, we'd like to work in as quickly as possible. And if you're an adult just trying to establish care, we can manage that as well.
Accessible.
Absolutely.
That's great for everybody. Yeah. All right. Dr. Powell, thank you so much. We'll start taking better care of our teeth.
Great.
All right. Thank you so much. Thanks for being here for Valley Health Minutes. I'll see you next week.